have to paint the picture that on that day in that emerge, if they have, say, 50 beds that they operate, 48 of them had sick, dying patients already admitted, and they're working out of 2 beds, and they probably had 12 patients with chest pain in the waiting room, and someone with a stroke in the waiting room, and then someone comes in with a breathing emergency, so they get the next bed, and that patient waits. That's the kind of environment we're looking at day in and day out, and once that environment gets so difficult, triage breaks down. Triage is the French word to sort. It means I'm just going to have a really good emerge nurse look at all those 20, 30 people out there and say, I think you're sick because I got to get you back in next. It breaks down, though, when there are no next beds to put them in. Then you just identify a whole bunch of people that need beds and be like, yeah, I can't do anything for you.
What about the people who are on the front line? How are they holding up?
I got to be honest, it's very demoralizing now, and burnout's growing. And you know, a couple reasons. One is that I'll actually go out on a limb and say there's nobody that goes into healthcare and wants to see people suffer and not, intervene. Like you can picture how some people might over a long time get a little jaded and a little bit harder, but nobody wants to see that day in and day out. And I can tell you, like, a good example, reaching out to my triage nurses across the province in some of these really bad emergencies, it's the worst job in the world. I don't think you can imagine what it's like to see, because if you think about 70 registered patients in your waiting room waiting to come in, and then 1 or 2 family members with each of them, and each of them coming up and pleading. And I want to say, too, not everything's life and death. You have people with 10, we see people with broken bones and their ankles kind of sideways, and we can't even give them pain meds for 10 hours, say, right? Like that would be a hard job to do day in and day out. So it becomes really, a lot of moral distress. And so we're losing a lot of our really good healthcare workers now because they're leaving, because they're saying, listen, I can't function in this current system. So they leave. That makes it worse, because then you've got hard environment with even less team members, right? And then so moral distress is big. The burnout is increasing for sure. And then again, you got to add, when I want to stress, like, one of the things the government did, this isn't ideology, this isn't if I vote right or left, they came out and said, we're going to disintegrate the system, we're going to change, but it's been 3 years of change, and it's been chaos. And if you don't know how to navigate the system day in and day out, now we have nurses, for example, that don't even know what silo they're in. So picture your, a mental health nurse, and you can picture how there's mental health facilities in the hospitals that would be under acute care, or maybe you're in Recovery Alberta, or maybe you're one of those nurses that works out in the community with primary care in mental health. They don't even know who they're reporting to, or who's paying their check, even to a degree. Like, it's that chaotic. So adding that distress and the burnout and then the chaos, it's got to stop. We got to give us some. Otherwise, what happens? We're in a scenario where there's a national and worldwide shortage of healthcare workers. They can choose where they want to go, and we're really struggling to recruit in an environment where, who recruits healthcare workers, doctors, and nurses to the Medicine Hat? It's the people working here and saying, hey, it's good here. Come on down and work. As soon as you lose that, it becomes really hard to overcome.